Well, it's old George de Carshot, keeping an eye on things. Right, I'm with the Health Minister. You've survived the day, and you're still out there talking to the public. How do you feel now?
Pleased to be out here, as you say, survived the day. Pleased to be out here talking to the public on the sites that we still have on our consultation list. That's the Waterfront, Overdale and the current site.
And I've just been talking to your civil servant over there, but I thought it was a bit mean to have a list of 40 and 26 of them were in St Helier. I thought that wasn't very representative, and then 10 of the others were in St Saviour. So it wasn't really an all-island approach to the solution, I didn't think.
You have to take into account that 33% of patients currently walk into the hospital for their treatment. And if you don't consider that as one of the options when looking at different sites, then you're creating a whole host of different problems. So
walk from where? They're not from their homes.
Walk from their offices sometimes, right, in the daytime if they've got an outpatient's appointment.
But I mean, obviously the analysis, you could do it on a minute degree, but I must say I'm not convinced. I've seen people struggling to walk up the parade with a broken ankle or a strained ankle. I mean, they get there, maybe presumably, but a lot of people wouldn't. They have to get there by taxi or car or some sort of wheeled device, don't they?
Yeah, what you described there is those coming into A&E, and of course that will always be a challenge for them wherever the direction they come from. But when you look at the routine medical and outpatient appointments, as I said, 33% of the people either live in St Helier or when they attend clinic or work in St Helier, and you can't ignore that, Mike.
I was talking to your civil servant also. I'm a great fan of the tin shed as a building, like the airport at Southampton, very basic thing. But inside that, you can make quite good, useful buildings. Now, a hospital, you need to keep people dry, a tin shed, and in there you can have very sterile areas which are all replaced as necessary every 10-15 years without demolishing the whole building. Is that the sort of approach that could be considered for this hospital?
Well, I don't think the sort of approach that you describe is the right one. What if we had more land, what you could do is look at the approach taken in Holland, for example, and other parts of Europe, where they have a site twice as big, so that would be a site 40,000 square metres, not 20,000 square metres, where you build a lightweight construction, knowing that you're going to put a new replacement next door in 20 years' time.
Well, of course, we don't know what's going to happen in 20 years. This is one of the problems of designing a hospital, isn't it? It's such a high-tech activity, we don't know where it's going to be.
Well, the only thing we know is going to be different to what it is today.
Yeah, but the tin shed element will remain pretty much the same. The roof, and the walls, windows, that doesn't need to change a lot, does it?
Well, it does, because what you described there is totally inefficient thermally. I would argue that this, what you're describing is not appropriate for Jersey. It might be appropriate for a field hospital, but it's not appropriate for the people of Jersey.
Describing it as a tin shed, it doesn't have to look like an agricultural tin shed, but the Association of Jersey Architects president is very keen on building a high-rise hospital. He says they could do 20 floors. What would be the problem? What is the problem with that for small amount of land?
20 floors
or
means
whatever,
20 floors does not give you your clinical adjacencies, i.e. the departments that you need to have close to each other. X-ray, theatres, recovery rooms would not be in the right place. 20 floors means that you have a tall, thin building, a lot of extra nursing and medical staff required to cover that sort of environment. 20 floors, anything can work if you throw enough money at it. 20 floors is not sustainable financially.
A great deal of attention has been dedicated to the site, and I would have liked to have heard much more about the design, what we're actually attempting to provide, what service are we actually providing. And I loved your quotation about affordable health care as a fundamental human right, and if that's the aim, that's laudable, but I would love to hear how we're going to achieve that.
Yeah, we haven't got into specific design yet. We're looking at, we know we need 20,000 square metres of ground floor space, and we've made sure that above that we can get all the appropriate buildings in, wards and other accommodation that's needed. And of course, whether the floors above take 20,000 square metres straight on top, or whether they become smaller to make it more aesthetically pleasing will determine the number of floors. We're not into design. What we are into, though, is designing what the health service would look like. So more care in the community, because that's what people have told us they want, and real care in the community, not lip service.
This is the division, because what is termed primary, to mine, there's a dividing line, which suddenly becomes hospital. If you want complicated dental work, that should be done in a hospital. If you want complicated work doing on your eyes, it has to be done in a hospital. More, they change. It's what's primary today is secondary tomorrow.